Hello, I'm Monica Schmoody, the market president for Cigna Mid-Atlantic. And Cigna is so pleased to be a gold sponsor for this year's Shining Night Gala. We wish we could have been there in person, but we're so pleased to have the opportunity to still support this event and to help recognize the distinguished heroes. At Cigna, we're committed to supporting organizations who share in our commitment to enhancing the health and well-being of each of the individuals we serve and their communities. We know that the funds raised tonight will support a number of important injury and violence prevention programs through VCU Medical in the Richmond community, and we're really proud to be a part of this essential work. So on behalf of Cigna, thank you, VCU, and especially this year's Shining Knights, for all that you do.
Good evening. We're the senior management team at the Wilton Companies, and we're here tonight to join you, though virtually, to add our support as a gold sponsor to this year's Shining Knights Gala. VCU Health is everywhere, providing emergency health care to those in critical need, providing cutting-edge research through Massey Cancer and the Pauley Heart Centers, as well as just being the go-to hospital for anyone and everyone in serious need in Central Virginia. The Wilton Companies operate in the same Central Virginia area, and we have a long tradition of supporting entities that serve our trade area. And it's hard to find anyone who's not been touched by VCU Health and the work of the MCV Foundation. Whether it's a family member, a friend, or a coworker, whether it's seeing VCU emergency facilities in a well-known location such as out on West Broad Street, or in lesser-known locations such as out in Quinton, Virginia, VCU is there as Central Virginia's only level 1 emergency care center. This service saves lives every day. So whether it's saving lives, treating injuries, or working to prevent injuries, the Wilton Companies say, thank you, VCU Health, and we say thank you to all of you who join us in supporting the Shining Knights Gala this year and the heroes that it recognizes annually. Thank you. Give it a big hand. Thank you, everyone.
I'm Brian Brown. I'm the Healthcare Director at Oregon, and it's a pleasure to be here tonight with you. It takes both people and facilities to help build communities and make them stronger. Oregon has had the pleasure of having a partnership with VCU Health over the years and have built many buildings throughout our community. We certainly know the building side, but the power truly comes from the people that work inside the facilities. And tonight, we are especially proud to honor those heroes that come to work each and every day to care for others despite their own risk. We appreciate all that you do.
Well, good evening, everybody, and welcome. Peter Buckley is my name, and I have the distinct pleasure of welcoming you to VCU's 12th Trauma Center Shining Night Gala, but of course the first virtually. And what a privilege it is. And I think even in the medium of virtual, we're going to have a lot of fun and a lot of celebration, recognizing great human resilience and also great community support and great care. As I said, my name is Peter Buckley. I have the privilege to serve as Dean of VCU's School of Medicine and also Executive Vice President for Medical Affairs. And I am honored to be with you for this very special event. And of course, this has become the new normal for us in a relatively short period of time. I believe we'll have a great evening together. We will experience some pivotal trauma events in the lives of 2 of our patients, and we'll also understand the commitments of VCU's Trauma Center and, quite frankly, its entire community, as well as our Shining Knights to save these 2 patients. We'll also have the privilege of hearing from our president of VCU and VCU Health System, Dr. Michael Rao. Now, because we're doing this on a different medium, I want to just point out some of the things of this evening. So for instance, the Gala program, which would have been at your seat, is now easily downloaded in the Zoom chat feature. The program is still terrific, and it contains excellent information about who we are, as well as why we're here tonight. So please be sure to take some time during the event to look at that, to learn about the honorees, To learn about our trauma center, as well as our Center for Trauma and Critical Care Education, our EMS educational programs, as well as our injury and violence prevention programs, for which we're raising funds this very evening. By the way, if you're sharing your experiences of our virtual Shining Night Gala tonight by social media, please use the hashtag SKG2021 along with your posts. Now, as I mentioned, we actually have a very esteemed gathering. It's our 12th gala, and I'd like to extend special welcome to some of our colleagues and our friends. I mentioned already Dr. Michael Rao, President of VCU and VCU Health System, and Dr. Monica Rao, our First Lady, and then Dr. Art Kellerman, our new Senior Vice President for Health Sciences at VCU and CEO of VCU Health System. Also, Dr. Vig Kasharajan, Chair of VCU Department of Surgery, and his wife, Dr. Sue Vignashar. I also want to recognize our entire VCU Health System senior leadership team. Want to recognize Mr. Gary Brown, who's Director of the Office of EMS for the Virginia Department of Health, and also his wife, Linda. Mr. Brian Sides, one of the trauma patients whose inspiring story you will hear about shortly, and also recognize his family and all of our trauma patients, whether we featured their stories here in the past year or not. We have 39 Shining Knights who represent everyone who had been a part of saving Brian's life, along, of course, with many others that comprise our trauma team. Want to recognize Dr. John Reevy Cantwell and his wife, Dr. Jordana Crone, who in particular established a fund to sustain injury and violence prevention efforts. Want to recognize Cole Snyder and his wife, Charisma, and their entire family, for whom the Cole Snyder Trauma Survivor Giving Back Award is named. Particularly then recognize Kristen, Mallory, and her family, who are this year's recipient of the Cole Snyder Trauma Survivor Giving Back Awards. We have many of our personal Shining Knights watching tonight, and you can find a full list of that in the program, as I mentioned earlier, as well as on the Shining Night Gala website. We have several honorary chairs, former chairs with us, including Clay and Randy Reynolds, Brenda and Tyler Hancock, Joyce and Richard Johnson, Lauren and Will Wade, Dr. Jerry Strauss and Senator Tom Norman, as I mentioned, Dr. Vig Kasharajan and Gil Miner, and Ms. Rosemary Tribble and Dr. Will Zulzer, Dr. John Ward, Dr. Jim Nyfield, and also on this evening, Dr. Joe Ornato and Dr. Harry Young. We couldn't do this without our many sponsors, and we thank you. As you know, there is a full list of all our sponsors noted in your program and also on the event website. Without their generous donations, we would not be able to continue our injury and violence program and all our programs. And so a special thanks particularly to our Gold Knight sponsors, Cigna, Horrigan, and the Wilton Companies. Also thanks to our Silver Knight sponsors, Allen, and Owens and Minor. And also our Bronze Knight sponsors, Atlantic Constructions, HDR, Jones Lang LaSalle, MCV Foundation, and Monolith Healthcare. And also to all our sponsors and our supporters in this very evening. Now, this is not only a first evening by virtual, we're also celebrating the 40th anniversary of our Trauma Center. Since the Trauma Center was designated in 1981 as the Commonwealth's first trauma center, we have treated more than 160,000 injured trauma patients. That's a staggering figure. In fact, it's the equivalent of 3 packed stadiums of lives saved through dedicated care. And if you are a trauma survivor or a member of a trauma survivor please be recognized and make a comment in the chat. We would be asking you to stand up. It is the Zoom equivalent of stand up and be recognized. So let's all give our colleagues, our trauma survivors, let's give them a round of applause virtually in the chat or share a supportive comment. If you are a 2021 Shining Knight, or if you've even been a Shining Knight in the past, or if you've identified as someone's personal Shining Knight, or if you served as an honorary chair, will you also please be recognized? I would say stand up. You can stand up at home, by the way, but please make a comment, make yourself aware, and let's acknowledge you as well. So it's now my opportunity and distinct pleasure to introduce Dr. Art Kellerman, who, as I mentioned earlier, is our Senior Vice President for Health Sciences at VCU and CEO of VCU Health System. And we're absolutely delighted that Art joined us this year. And so Art, over to you.
Thank you, Dean Buckley. I want everybody to know that first, this is my first Shining Knight Gala. This is not my introduction to the world of trauma care and all that goes into it. I have more than a CEO's interest in this center and in this particular program at VCU because this was my clinical world for over 30 years of professional practice, first in Seattle, later in Memphis, Tennessee, and for many years at Emory and Grady Memorial Hospital in Atlanta, where I both founded a Center for Injury Control, but also became chair of the Department of Emergency Medicine at Emory. So I have been a trauma team member for virtually my entire adult life as a clinician, and I know everything that goes into it. And you, all of you on this line tonight, all of you who've benefited from the care, need to know and surely do know that we have one of the finest trauma prevention and trauma treatment programs in the world, right here in Richmond, right here in the Commonwealth. So while I spent a lot of my career outside of this state, I got here as fast as I could, and I'm really glad to be with all of you tonight. VCU and VCU Health are institutions on the cutting edge of advancing science, clinical care delivery, improving outcomes, and constantly driving to make things better and better, not only in the operating room and the critical care unit, but in the community as well. And that is really represented in our trauma program. And two of the unique aspects that really take us beyond the remarkable walls of the medical center and our trauma ICU, our operating rooms and facilities and teams, and you'll hear more about them tonight. But this program reaches into the community in two vital ways. First, as you heard, we support the Center for Trauma and Critical Care Education because we know, and the military showed this before anyone else, that if the patient doesn't live to reach the trauma center, there is nothing the finest team on the planet can do. And this program has invested years, over 25 major courses, and has trained nearly half of all of the ground and air critical care and pre-hospital professionals in the Commonwealth of Virginia to be at the very top of their game, not only in caring for trauma and injury patients, but all patients. That is an extraordinary investment for a trauma center and not common at all. The first program of its type in the Commonwealth and still by far the best. Over the last 40 years, this program has trained countless providers. And even as the pandemic raged and these programs had to continue, not only the delivery of care, but training, they adapted hybrid courses such as Stop the Bleed to teach bystanders how to control life-threatening bleeding, as well as the legendary Advanced Trauma Life Support Program, so that they could continue even in the rigorous precautionary measures required for the pandemic. So this is an extraordinary group. The other thing that this trauma center has done is that it has put enormous time and effort and attention into injury prevention. And I know as an ER doc, and as a public health professional, that the best way to save a victim of life-threatening trauma is to prevent the trauma from ever happening in the first place, or reduce its severity as much as you can before the injury happens. Many of those programs, and there are a lot of them around the country, are supported primarily by public health professionals, but our trauma team members themselves are integral to that effort, up to and including the director you're going to hear from in just a moment. So this injury and violence prevention program works all over the community and increasingly around the Commonwealth. And as the V implies, they're as focused on preventing violence and particularly gun violence, now a particularly challenging problem in Richmond. And they are all in, and we are all in at VCU Health with them. I can't wait for you to see the stories tonight of these remarkable patients and the extensive number of team members required to bring them through. It's inspiring, it's ennobling, and it's what gets us going every day and every night. And you will hear at the end of the evening from VCU President, Dr. Michael Rao. Now, one quick heads up before I turn things over to Dr. Avitanos, and that is some of the video, in fact, a significant amount of it tonight, was shot while care was being given prior to the pandemic. So if you're sitting there, as we all are, conditioned by a year of enormous challenge and go, oh my God, they're not wearing masks. Oh my God, they're too close to each other. No, that was scenes taken before the pandemic. At VCU Health, safety is always number one. And we have been one of the most extraordinary health systems in the country at adapting and overcoming the COVID pandemic. So with that, it is my great pleasure to introduce Dr. Michael Avitanos, Professor in Chief of the Division of Acute Care Services. I could go on half the evening talking about his accomplishment, but just know he is the designated acute care coordinator for the state trauma system. He directs our Level 1 Trauma Center. He is the Fletcher Emory Ammons Distinguished Professor of Surgery, and he in the past has served as the past president of the Pan American Trauma Society. So he is renowned not only in the Commonwealth and in the United States, but across the world for his expertise and his dedication to trauma care and to trauma prevention. Ladies and gentlemen, Dr. Michael Avitanos.
Thank you, Dr. Kellerman, for this very kind introduction. Good evening, everyone. Usually, like Dr. Buckley, Dr. Kellerman said, we usually are together in this celebrating this incredible efforts and incredible achievement by our trauma center. So I wish it's going to be a phenomenal night, and even if we're doing it virtually, it is really my privilege to help call attention to and honor a group of shining knights who protect and save lives every day. These resilient shining knights work together tirelessly to save lives every day and in the face of every challenge, be it mass casualty, be it civil unrest, be it global pandemic. Tonight, you will learn the story of care providers from Central Virginia who came together to save one patient, not only saving his life when all odds were against him, but then over hours, days, and months, continued to care for him as they restored his health so that he could return safely to his family and to his community. They collectively used their knowledge and skills, along with devoted loved ones, to save and care for him through his journey of survival and recovery. Our featured patient tonight was selected for a very special reason. He represents the incredible odds and challenges that face the world of trauma today. When a motor vehicle strikes a home and has a pole pierce the windshield and pin the driver inside, few people survive such a catastrophic crash unless they come to a trauma center with more than 40 years of knowledge, expertise, incredible institutional investment, and experience what it takes to save one life. Over these years, as Dr. Kellerman have said, we have worked hard at building the most comprehensive trauma center in the country, staffed 24 hours a day, 7 days a week, with highly trained trauma resuscitation teams and clinical experts across the entire continuum of care, ready to provide critical life-saving measures and care. For patients whose lives hang in the balance, only orchestrated, seamless care from experts can make a difference. This is what we do. This is what you will hear about tonight. Few people have a grasp of what it takes to save one life. Fewer more have the realization that we do this more than 4,500 times per year. As Dr. Buckley said, since our first designation as a level 1 trauma center in 1981, our trauma center has worked with the community partners to treat well over 160,000 patients.
VCU Health and the team at the VCU Trauma Center are committed to providing unparalleled care for all trauma patients. And we know that optimal life-saving and timely care needs to start in the field before trauma patients reach the VCU Trauma Bay. To this end, we have developed the Center for Trauma and Critical Care Education, CTCCE, where for the past 40 years, we have regarded EMS, the pre-hospital providers, as part of our team. Through the CTCCE, we provide comprehensive education, training, and leadership to the EMS community. In the past 2 years alone, the CTCCE trained more than 10,400 physicians, nurses, EMS providers, students, and other allied health professionals. So if you do the math, that number is greater than 200,000 trainees to date. Another essential mission of the VCU Trauma Center is the reduction and prevention of injuries and violence through ongoing hospital and community-based prevention and intervention programs, education and innovative research, and committed community engagement and outreach throughout our city and the entire Commonwealth. We cannot ignore what we witness daily, the devastating impact on our patients, their families, and our community. The indirect effect of the COVID-19 pandemic have really been horrific for some of our most vulnerable population and their providers here in Central Virginia. Gunshot wound injury admittance to the VCU Trauma Center increased 51% during 2020 due to various factors, including intimate partner violence and domestic violence, which were alarmingly high. Our trauma teams, both clinical and non-clinical, including our injury and violence prevention programs and CTCCE, were needed more than ever, and I am happy to say they're able to help people more than ever despite some pandemic-induced limitations and challenges. I believe this is what makes our trauma center unique. Another resource we have for trauma survivors and their family members is the Trauma Survivors Network. The Trauma Survivors Network enables the VCU Trauma Center to bring together trauma survivors and their families to connect and support one another. From this program, we have also developed our peer visitor program, where previous trauma patients visit with current patients and their families to guide them through their stay and help normalize their experience. Both of our patients that you will hear about tonight have given back in this way. I cannot wait for you to hear about them. Few people are aware of what our trauma center does apart from the direct life-saving critical intervention. Through our injury and violence prevention program, our CTCCE, our Trauma Survivor Network, our dedicated staff help so many. They help people stuck in an unhealthy pattern of behavior or lifestyle, people who are experiencing intimate partner violence, people struggling with drug and alcohol dependence, people making dangerous choices when driving. We connect trauma survivors with current trauma patients, provide tools to safeguard against falls in seniors, provide psychological intervention services, educate non-clinical personnel on how to stop bleeding from penetrating injuries with the Stop the Bleed programs. There are so many different communities we can serve through these programs, and that in turn serves all of us as one large community. So what does the Gala support? It supports injury and violence prevention initiatives. It supports the Trauma Survivors Network. It supports the CTCCE, Stop the Bleed program, and more, all of which are vital to our community. So I humbly ask that if you are able to, would you kindly give tonight to support all these efforts to help our community? There should be a link to our giving site appearing on our screens now. We have been so fortunate to have received support of our trauma center and community engagement programs from many partners in the community. Through this gala, you, our sponsors and attendees, have supported our efforts, and we want you to know that your contributions are singular in allowing our trauma education and training and our injury and violence prevention efforts to continue. The long-term strategic vision of the Trauma Center, our Center for Trauma and Critical Care Education, and our injury and violence prevention programs is dependent on private support. support from foundations, support from corporations, and support from special individuals and families like all of you watching tonight. The support of our leadership team is what enables the VCU Trauma Center to be integrated into the strategic vision for the future of the VCU health system. We receive unprecedented support from Dr. Rao, Dr. Kellerman, Dr. Buckley, Dr. Ron Clark, Dr. Paul Wazlowski, and Cheryl Garland, and especially my boss, Dr. Kasarajan, and many, many others who see and understand with us the central growing role that our trauma center must play and does play in the community. So I, along with the entire team, am proud to work with such leadership. One of the most special types of support we receive comes from trauma survivors who give back to help those going through what only they uniquely understand. 7 years ago, Dr. John Reevy Cantwell and his wife, Dr. Jordana Crone, were inspired by Cole Sidner, Dr. Reevy Cantwell's patient, and the first recipient of the Trauma Survivor Giving Back Award. In Cole's honor, they made a lead gift to create an injury and violence prevention endowment to establish a fund aimed at the long-term stability of injury and violence prevention efforts. This endowed fund offers another opportunity for donors to engage with and support our work. In light of their gift, we renamed the award the Cole Sidner Trauma Survivor Giving Back Award. This year, the Cole Sidner Trauma Survivor Giving Back Award will be given to a very special trauma survivor, Kristen Mallory. On June 9, 2013, Kristen Mallory's life was forever altered.
I need you to stay still, because if you move your head around, it can be worse. I need you to stay as still as you can. It is by far the worst crash that I have ever worked where someone has survived. Kristen inside that car and the mangled metal and the engine sitting on top of her lap and the insane amount of medical problems she still has today.
She takes over 50 pills a day. She has to get an infusion every day. She still gets up and fights through this to come out and share her story, to save other lives.
It really makes me proud that she is taking something that could have been so negative and turning it into a positive and working to make people aware of what a few minutes of a poor decision can make, and also remind people that how precious life can be.
We show the real thing when we talk. Mom has had to help me with everything, Mom and Dad, for 6.5 years. It's not just instantly goes away. It's a day-to-day thing that we all have to deal with.
They get a big picture of what she went through and just how many people one decision to drink and drive can reach.
VCU, I was saved there, and that hospital means so much to me. I'm so thankful for what Project Impact does, and I definitely am so excited to work with them.
Our job is to prevent needless injuries, and that's what VCU is all about, as a level 1 trauma center.
We know people who have lost their whole family and lost their loved ones or kids or whatever to this. I can feel guilty at times that I'm still here. I do these talks in honor of them and in honor of their loved one, and I'm speaking for them when they can't, just advocating for people to not do drink and drive.
She goes to prisons, she goes to high schools. Kristen is all over the place telling her story and impacting people and changing their attitudes and behaviors.
I definitely thought I was invincible and that this wouldn't happen to me. And I think that's the mindset of almost all younger people. And I just want to go in and show them the reality of this can happen to anybody.
Here she is, instead of playing poor me, I'm a victim, she's taking it and she's using it for good.
Getting the chance, the opportunity to speak is really what she looks forward to, that's her best days. She lights up.
I want to go wherever I'm asked. I want to share my story with as many people as possible.
As she said, Kristen feels like she was given an opportunity through a traumatic experience to share her story and hopefully reach people and prevent them from needlessly harming someone else by driving drunk. She formed a nonprofit called Mallory's Movement Against Drunk Driving and speaks about her ongoing experiences managing pain and physical challenges that resulted from a 100% preventable injury 8 years ago. Kristen has shared her message at high schools, colleges, prisons, police department, training academies, military bases, conferences, and pageants. Every day, Kristen chooses to have a positive attitude and seek out others to help. And her unique perspective helps people in ways she never would have considered before she was harmed by a drunk driver. So it is our great pleasure to present the 2021 Cole Sidner Trauma Survivor Giving Back Award to Kristen Mallory. Kristen, we will love it if you would share a few words.
Thank you so much for the amazing recognition, but truly the real heroes are the amazing doctors and nurses in the VCU Trauma Center, the surgeons who put me back together, especially Dr. Albuquerque, who saved my leg from amputation, all the amazing nurses on the pediatric floor, and the child life staff. I want to also thank the first responders who got me out of the mangled mess our car had become. But most of all, I want to thank my parents. They have never stopped supporting me or believing in me. They have been by my side every step of this journey. VCU saved my life, and for that I am forever grateful. I am also blessed to have so many others who jumped in to help once I was discharged from the hospital. I wasn't sure where my life would go after I lost so much in the crash. Because of my traumatic brain injury, I lost the ability to attend college and become the elementary school teacher I dreamed of being. I lost most of my friends. I lost my independence. I lived my life in 24/7 pain with no hope for the future. That is until I was given the opportunity to tell my story to a group, and from that one talk came many more. It wasn't until one day during a talk that someone pointed out that I might not be teaching kids in school, but I am teaching. I share my story to spread awareness about the dangers of drinking and driving. And if I can impact just one person's actions and ultimately save a life, that's the best why I could ask for. Mallory's movement against drunk driving wouldn't be what it is without the support of the Victim Services Unit of the Department of Corrections, YOVISO, Youth of Virginia Speak Out About Traffic Safety, the Virginia State Police, VCU Injury, Violence, and Prevention Program, and let's not forget my friends, our board members, and my amazing tribe that have supported me all the way through this. Award or no award, I will continue to share my story through Mallory's movement until there is no more injuries or lives lost because of drunk driving. Thank you.
So let's share some love with Kristen in the chat. For tonight's featured patient, Brian Sides, life was good. Brian was working with his father and their family business. The Christmas season and all its festivities had begun. Brian and his wife were experiencing the magic of Christmas through the eyes of their 2 young daughters, and the whole family was looking forward to attending Chester's annual Christmas parade. Sunday, December 11, should have been a memorable day for its happiness, but it became a day the family would never forget for very different reasons. Brian and his family began a long journey that none of them ever expected to be confronted with. A marathon of facing death, the will to survive, and the drive to recover.
He's a great dad. We got 3 girls and they adore him.
He's a very giving and caring person. He's got a very tender heart. He's kind. I think he's a good dad and a good husband, and he's a great son.
It was a Sunday. I just talked to Brian about 9:30 in the morning, and he said, all right, honey, we're finishing up here, and then I'm gonna drop Wes off at his house, and I'll be back. 10:30 came along, 11:30, started texting him, where are you at? We're gonna be late. We were supposed to go to the Chester parade that day.
Initially, when we got there, dispatched for a motor vehicle collision. We had several updates going into it that potential of somebody being trapped in the vehicle. It didn't look good. Found a vehicle into a attached carport on one end of a home that was in a bend of a 4-lane road that runs right through Chester.
He was unresponsive. He was cyanotic. He had labor respirations. He's in really bad shape. We got to make a quick move. Once we got access to him through the driver's side door, it was pretty quick and easy. Get a collar on him really quick and get him out. When you run those, I mean, it's one place and one place alone for the most part, especially at that time. We're down Route 10, we're getting on 95, and we're going straight to MC.
So when Brian came in that day, he already had been intubated by EMS on scene. So he was unconscious and minimally responsive, which is just already a sign that things aren't the best and that he may have a lot of significant injuries.
The trauma team is a group of at least 20 people that pretty much take over the evaluation and management of the patient at the same time and doing different treatments. So we very quickly did things, and he got more access for IV so that we can start giving him blood. I believe we put in a chest tube in the trauma bay. We also realized by the vector of energy of the hole in his lower chest that he likely had abdominal injuries at the same time.
It was about 1:45 or 2:45 that my now sister-in-law called me. She said, well, Brian's been in a horrible car accident and you need to get to the hospital.
He wasn't with us a long time, but long enough to realize that initially his blood pressure looked okay, but his heart rate was very fast, which could mean a lot of different things. We worked quickly to ensure we had good IV access and got him into the CT scanner as soon as possible.
He had lost a lot of blood. They didn't know if he had brain damage or anything like that.
Yeah, we were in the Dominican Republic. We'd just gotten there. Probably within a couple hours we knew. We did a lot of praying, a lot of tears. I was calling the hospital constantly. Of course, they have him under trauma name.
Being so far away, it was very comforting, knowing what was going on, and we knew he was in good hands.
So he quickly got assessed, started the treatment there, and I think we moved him pretty quickly to the operating room.
Communication specialist Jenny Womble received the call from Chesterfield Fire and EMS. She activated the trauma team and provided the critical information trauma surgeon Dr. Edgar Rodas and Dr. Jonathan Bennett, trauma resuscitation nurse Tiffany Pignatello, and emergency physician Dr. Lisa Dodd needed to resuscitate Brian. Brian was rapidly assessed and blood products were administered to replace the blood he was losing from internal injuries. Within 20 minutes of arriving at the VCU Trauma Center, Brian was in the operating room. The pole that entered Brian's truck had struck the right side of his abdomen with such force that caused the most severe type of liver injury and ripped his right kidney off of supporting structures and blood vessels. The force tore a hole in his diaphragm and crushed multiple ribs. Brian was bleeding to death. Only the extraordinary coordination of both human and physical resources that is present at VCU Trauma Center would be able to save his life. While the trauma team was taking Brian to the operating room, the OR team of registered nurse Jennifer Journey, anesthesiologist Dr. Daniel Milan, and certified surgical tech Tammy Herbert activated the massive transfusion protocol, which is our protocol to give a large amount of blood product very quickly, and prepared the instruments and supplies Dr. Rodas and Dr. Bennett would need to control the hemorrhage. The blood bank was notified that Brian was hemorrhaging to death, and transfusion medicine and laboratory personnel, Kim Squires, Kimberly Eason, and Michael Ribbon worked to prepare the blood product that Brian was administered to save his life.
It's a pretty bad feeling when you get a young trauma patient in the operating room and it seems like you already start behind, you're losing the battle despite, the very quick transfer to the trauma center. As we dove into his injuries, we quickly realized the amount of injuries and the severity of the injuries, as you said. So we're doing what we call damage control surgery. So just trying to control really all the profuse bleeding and control the contamination. Once we packed his abdomen, the chest temporarily, we moved into the interventional radiology suite for controlling that bleeding.
You have the anesthesiologist, you have the trauma team, you might even have some of the STICU team coming down to help out, depending on how sick they were. And Brian was sick. He was bad off.
Basically, what we need to do is we need to look at where exactly the bleeding is coming from and if we can plug that immediately. It's not done by one person, it's a team. We have nurses, technologists.
And in his case, it was a pretty seamless case considering how seriously injured he was. But overall, as Dr. Prasad said, when they come in, sometimes their arteries can clamp down and you don't see an active bleed right away. But in his case, everything went very well.
He came to from the OR quite ill, and I just remember hearing about him and all of his injuries and just being shocked that we had made it this far.
I remember walking up and the head nurse, he walked up to me and he said, I just want to prepare you for what you're about to see. He said, this is probably going to be the lowest. There's going to be lows and there's going to be highs, and you can't get too low and you can't get too high.
In many cases like Brian had, it's kind of being in the ICU, you take a step forward, you take two back. We knew he had the open abdomen. He did require another trip to the operating room, but they were able to quickly close his abdomen, but he still had many other injuries, broken ribs, orthopedic injuries. So it's very challenging. So it's quite a process, and there are good days and bad days.
The goals of the ICU team are to make sure the patient stays warm, make sure the blood pressure stays up. We basically played defense at that point and get him resuscitated to the point that he can go down to the OR again for another trip.
The name of the procedure that we do is called damage control surgery. And so you do, again, a minimum to recover the patient's physiology in the intensive care unit, and then try to optimize him as much as we can with the ICU team, and then bring him back in a matter of fact, finish the surgery that we initiated.
He absolutely was septic. After having undergone this surgery, he had a bacteria in his bloodstream, which is pretty common in the setting of having extensive abdominal injuries. Basically, you've got all these bacteria in your GI tract that are keeping up an ecosystem. And with that trauma, that bacteria leaks to places it's not meant to be. He did require antibiotics for quite some time to treat this infection.
And as a father, and knowing that he already had 2 children, we're thinking, what's going to happen? But the team of doctors and nurses were just incredible.
His survival was slim to none. It was rough, especially being home with the girls, but we knew it was going to be a roller coaster, and we knew that we didn't want to hope for too much and then be let down.
From the operating room, the interventional radiology teams, including Gavin Pierce, Tamra Gillis, and Dr. Uma Prasad, embolized bleeding vessels in Brian's liver that were too deep to surgically control. This specialty is not available in many hospitals. This seamlessly coordinated effort doesn't occur every day. Yet, the professional team at VCU Trauma Center execute this process with such skill that results reveal a master technique. Finally, in the ICU, teams of nurses including Kim Baldwin, Denise Butler, Amy Chodorov, and doctors including Dr. Saba Kortum, and intensivists including Dr. Megan Rashid, as well as team of respiratory therapists, clinical pharmacists, and others, worked seamlessly to support Brian and ensure his blood pressure was maintained to sustain his vital organs. After 48 hours in the ICU, Brian was finally stable enough to return to the operating room for more definitive procedures. In critical trauma care, patients often require multiple trips to the OR and stage procedures to optimize their ability to withstand surgery while carefully repairing damaged organs and tissues. His small intestines were so severely damaged that Dr. Rodas had to divert his stool into an ileostomy bag. However, with the ileostomy and the long impact and severity of his injuries, Brian would need all the energy and vital nutrients to ensure healing. Clinical dietitian Emily Munez was instrumental in calculating Brian's nutritional needs and preparing the necessary formulas to begin healing. Beside nutrition, Brian was in severe danger of developing infections. So infectious disease specialist Dr. Jillian Raybould was called in to help tailor the antibiotic regimen Brian would need due to severe bacterial contamination from his damaged intestines. Slowly, with meticulous care and critical ongoing management, Brian began to stabilize and heal. Brian's traumatized body was weak from his initial blood loss and multiple injuries. As a trauma center, we coordinate with our physical medicine and rehabilitation specialists early on to assist the ICU teams on how to gently help patients on their recovery journey. Only level 1 trauma centers like VCU have these rehabilitation specialists as part of our daily staff. Physical and occupational therapists, including Dr. Carmel Colon and Ashley Daniels, work with the nurses to exercise Brian's arms and legs so that when he's able to get out of bed, walk, or even just move to a chair, he will have the strength to do so. Finally, after an entire month in the ICU, Brian is able to transfer to the acute rehabilitation hospital at VCU. Physical medicine and rehabilitation specialist Dr. Pat McGowan develops the rehabilitation plan for the team. Brian requires inpatient rehabilitation for almost another month, gaining strength, relearning to walk. But due to the challenges that come with having an ileostomy and multiple injuries, Brian needs to return to the acute care setting due to poor nutrition and persistent infections. The antibiotics and dehydration associated with his severe injury are causing his remaining kidney to fail. Brian requires a procedure called antibiotic desensitization. Dr. Daniel Grinnan, along with Dr. Raybould, coordinate this very specialized process that is again risky to Brian's life. However, the stakes are too high to not take the risk. If the procedure fails, the bacteria that lingered in Brian's bloodstream from the initial injury could kill him. Brian continues to face challenges in his journey to recover due to the damage that has been done to his bowels. Brian requires 3 additional months of intermittent hospitalizations to manage his nutrition and electrolyte balance that frequently occurs with trauma patients who have ileostomies and severe bowel injuries and internal scarring. The acute care team of Renee Carbone, Rebecca Dennis, and OSME specialist Fern Alderfer care for Brian and his family over these challenges. Finally, 5 months after his injury, Dr. Rodas determines Brian's intestines have healed enough to have the ileostomy reversed. This is a procedure that connects the small intestines back together and restores the digestive system back to normal.
We got to the point where Brian's abdomen was closed. We had the breathing tube out. I think it's sometimes even a little bit more challenging because patients are in pain. I remember Brian being in pain and us trying to, find that happy medium of controlling his pain, but we needed to start on getting him up, starting the physical therapy and occupational therapy.
He was always strong. About the only thing we had difficulty with was getting him to move around.
I started working with him. He required a lot of assistance. So we look at how he's doing with bathing, dressing, getting back into his daily routine. So initially, we worked together with physical therapy to at least get him sitting up at the edge of the bed, to participate in simple activities. Over the next few sessions, being able to progress him out of the bed.
I remember just the family support being so wonderful that helped push him along and get us to that point where we could get Brian safely out of the ICU.
I think they sort of suspected we're going to have to take out the kidney, but the ileostomy, they had never mentioned that before, and I think that they discovered once they got.
Yeah. Brian went into kidney failure with the one kidney he had. The kidney doctor said that he would recommend they reverse the ileostomy as soon as possible because that was causing, they thought, the kidney to help shut down. And his kidney did come back. He never had to go through dialysis or anything, but Dr. Rhoda said, I'll be in the office on Monday, please bring him in, and I did.
We are having a constant communication in trying to see when is the optimal time that we do all these interventions, and sometimes it goes off script because the patient needs to have it earlier.
He had a long ways to go, but I do remember he was always willing to participate. And so that always makes a difference in the patient when they're kind of motivated, regardless of where they start at. When they have the motivation to participate, you know that there is going to some way be a good outcome.
He was never left alone when he was in his coma, and for the most part, the whole time he was in the hospital. It was a group effort.
And we need a family. We pulled together as a family to get Brian through this.
We get there, we hand the patient off, give the report, how good or how bad they're doing, what we've done to either stabilize or help the situation. And after that, once the teams in the hospital take over, a lot of times we never get a follow-up. So it was good to see that everybody collectively from the beginning to the end that played a part in this, it was a good outcome for him.
We run these calls, I don't want to say we see them all the time, but we see a fair share of them. You just kind of like, you always wonder how they turned down. And it's really good to know, here it is years later that he's got somewhat of a normal life.
It's just such an amazing process and rewarding job where we get to see them get better. We get to help that patient get out of the ICU. We get to see that progress. And then when we get to see patients come back that we've helped, it's just such an amazing and rewarding thing that we get to see.
It's exactly why we go into medicine and try and help people. And he got where he went because of all the incredible care of all the teams working together.
They treated us like family. Yeah, they did. Every nurse that took care of him took just as much care for him as they did, for both of us. They didn't just take care of him, they took care of me.
Brian's recovery continued as he gained strength and regained a sense of purpose with his family, but he needed something more. His journey of recovery is one that thousands of injured patients endure every year. Only trauma survivors truly understand what it takes and what it's like to be on the brink of death and face the unknown. When they survive, what would their lives be like if they do? VCU is one of the few trauma centers that offers trauma patients a support network called Peer Visitors. Brian has chosen to give back and share his journey and offer support to help those experiencing what he had gone through. Without Brian's family and their unwavering support, someone at his bedside every hour, every minute of every day, Brian's outcome may have been quite different. Without the seamless orchestrated care provided by his caring providers, his shining knights, he would not have survived. It takes a village, and we are that village of providers that makes VCU the only comprehensive Level 1 trauma center in Central Virginia and the best Level 1 trauma center in the country for Brian and for all trauma survivors and their families.
Good evening. Thank you for being here tonight. I would like to express how grateful I am for everyone that has helped me through my journey of recovery, and from where I come from as far as a 5% chance of survival rate. It's been almost 5 years now since my accident, and I'm happy to be here and to talk about, the people that have saved my life. I owe so much to them that I can never repay back. I've been to previous Shining Nights Gala, and I always, thought that, the people that come up there and they tell their amazing stories, and thinking that how great it would be if I was able to go up and share my story and thank my providers for everything that they've done for me. And finally, when the day came and I got the call, I was super excited and grateful for having this opportunity to be a part of this. And as far as how I would explain the Shining Knights is how they sound. They shine light through the darkest of situations, and they are the people that rescue us from our injuries or from our illness or anything that we're going through that we need their help with. And I cannot thank them any more than what they have given me. They've given me a second chance of life. The other people I would like to thank other than the providers would be my family. I mean, with my wife, my mom, dad, brother, sister, and other family members, they stayed with me every day, and I couldn't go out with 1 second without one of them being in the room with me. They gave me strength to be strong and that everything was going to be okay no matter what. In conclusion to this, I would like to thank the Trauma Center for taking care of me and working around the clock to help me through my recovery process. And I thank VCU for giving me the chance of being a part of the VCU Gala, and I'm grateful for everyone here that have helped me, and I truly thank you.
It is now my honor to call the names of our 2021 Shining Knights. Please feel free to cheer your loved ones on or just show your support for all of the Shining Knights in the chat. Robert A. Covington, firefighter, paramedic, primary caregiver, Chesterfield Fire and EMS. Larry Kirkland, Jr., firefighter, secondary caregiver, Chesterfield Fire and EMS. Lieutenant Matt Fletcher, Chesterfield Fire and EMS. Riley Gorman, firefighter, Chesterfield Fire and EMS. Jenny Womble, communications specialist. Dr. Edgar B. Rodas, trauma attending. Dr. Jonathan D. Bennett, trauma resident. Tiffany Pignatello, registered nurse, emergency department. Dr. Lisa Dodd, emergency medicine attending. Jennifer Journey, registered nurse, operating room. Dr. Daniel A. Milan, anesthesiologist, operating room. Tammy Herbert, certified surgical technologist, operating room. Kimberly Squires, medical laboratory scientist, transfusion medicine. Gavin Pierce, registered nurse, interventional radiology. Tamra Gillis, technician, interventional radiology. Dr. Uma Prasad, interventional radiology attending. Kimberly Baldwin, registered nurse, intensive care unit. Denise Butler, registered nurse, intensive care unit. Dr. Saba Kurtum, intensive care unit resident. Dr. Megan Rashid, intensivist. Dr. Richard Coons, physical medicine and rehabilitation attending. Dr. Patrick McGowan, physical medicine and rehabilitation attending. Renee Carbone, registered nurse, trauma step-down unit, Main 9 Central. Rebecca Dennis, registered nurse, trauma step-down unit, Main 9 Central. Amy Shodorov, registered nurse, intensive care unit. Emily Muñez, registered dietitian. Dr. Jillian Raybould, infectious disease attending. Dr. Dan Grinnen, medical respiratory intensive care unit attending. Dr. Brian James Strife, interventional radiology attending. Kimberly Eason, Medical Laboratory Technician, Hematology. Michael Ribbon, Jr., Senior Medical Technologist, Microbiology, Immunology Laboratory. Cheryl LaCroix, Registered Nurse, Patient Advocate. Crystal Briggs, Registered Nurse, Wound Care. Fern Alderfer, Registered Nurse, Wound Care. Dr. Carmel Colon, Physical Therapist, Acute Physical Therapy. Ashley Daniels, Occupational Therapist, Acute Occupational Therapy. Dr. Katie Marr, Clinical Psychologist, Trauma Center, and Evans Haynes Burn Center. Karen Anderson, Registered Nurse, Home Infusion Coordinator. Lindy Sides, Brian's mother and formal surgery trauma ICU nurse.
Wow. To see a patient's journey through that continuum from the point of impact all the way through, and the battles that had to be fought and won over and over again, and the critical role that so many people, an entire system of care that absolutely includes the family as integral partners in that effort. And most of all, the patient, the courage, the determination, the resilience that Brian showed over and over again. That's just inspiring. Those stories play out at VCU Health thousands of times a year. And all of you with us tonight, the sponsors of this event, all of you, you're part of that team too, with your support, whether it be in the good things you say to us in the community or the material support that you provide. It means the world to us. Thanks to all of you. With this, I'd like now, it's my distinct honor to introduce the president of VCU Health System and VCU University, Dr. Michael Rao. He is a patient advocate and a student advocate and a community advocate, and the trauma program is very near and dear to his heart. President Rao.
The work of VCU Shining Knights is truly heroic. My colleagues are unwavering in their dedication to the desperately needed care for humanity in the face of unimaginable trauma, the COVID-19 pandemic, and our country's push for equality. Our trauma team often says they're just doing their jobs, but it's really important that we recognize their unique dedication as professionals and as people. I've witnessed their life-saving work and incredible compassion on the many rounds I've done through our hospitals and clinics. They save lives, they restore bodies, and offer comfort, warmth, and oftentimes hope. The stories we heard this evening are absolutely moving. From the moment a patient's treatment begins with the arrival of EMS to the trauma team's evaluation in the emergency department, our world-class care providers are always ready to save lives. From the nursing staff and anesthesiologists to our therapists, and our care teams are providing incredible care to all who come to us when every second matters. I'm also really grateful to be part of a team dedicated to upholding the highest ethical standards while serving all who come to us for urgent, life-saving trauma care. When acknowledging VCU's Evans Haynes Burn Center's unique status, it's not an exaggeration to say that we excel in our role as the only comprehensive adult, pediatric, and burn Level 1 trauma center in this region. There's just so much to be proud of. You know, in the short period from 2019 to 2020, the Center for Trauma and Critical Care Education program trained more than 10,000 physicians, nurses, EMS providers, students, and allied health professionals. That's really astounding. And our injury, violence, and prevention program facilitators are absolutely united in their mission to create safer communities through education and intervention, because all human beings deserve to have the resources that they need to live a life free of danger and harm. We're able to succeed in our mission to guide trauma patients on their pathways to recovery and rehab, as well as prevention, because so many of you are generous donors who believe in our mission to serve, treat, and heal all of the people who come to us and face complex difficulties. We're able to serve and improve the human condition because of your faith in us, and I thank you.
We are grateful to always have Dr. Rao's support. He really gets it, understands and supports our mission to save lives and to prevent injuries in the first place. I have one final award to present tonight. This year, we are incredibly grateful and honored to induct a very special individual who has been there since the very first Shining Night Gala in 2009. This year's inductee into the Shining Night Order of the Knights of the Round Table is a very special person and is none other than Joe Cottoncooler, Director of the Video Production of VCU Health. Joe started with MCV Hospital Marketing in 1991, and since then, through various roles, he has always remained covering VCU Health and the MCV campus for the past 30 years. And he personally told me that the gala is his favorite thing that he ever covered in the past 30 years. Joe never takes it lightly or for granted that patients and their families will so readily invite him into their lives and share their very personal stories with him. We can see that Joe puts his heart and soul into his work. He will tweak a segment for hours just to get it right. He will work through challenges presented by footage, time constraints, logistics, doesn't matter. But we can also see the joy he gets from his works too, as it comes out in the pieces he produces. For me personally, he has been an incredible partner in this journey. I attribute our success largely in part to his incredible vision and commitment. How do you express VCU Level 1 Comprehensive Trauma Centers so others can really see what we do and who we are every day? Joe has captured the magic that happens when hundreds of committed and skilled and compassionate professionals come together to save the life of one person. There's a synergy and energy that happens with all these different people working together with a singular focus to save one life. Joe is able to recreate this magic year after year for all of us to see and appreciate. And for all that, we are forever grateful. And for that, on behalf of the VCU Shining Knights, we welcome Joseph Cottoncooler to the Order of the Knights of the Round Table and invite Joe to accept his award.
Oh, I am honored. I am honored. Thank you so much. Oh, that means so much. I don't know what to say.
Well, you've been saying that for years.
You know how much this means to the event means to me, and I am just humbled and incredibly grateful.
Oh, we're grateful.
So this is validating.
Yeah, absolutely.
Thank you.
Thank you.
So thank you all for joining us tonight at this unique Shining Light Gala. I hope our program tonight allowed you to see the tremendous teams of people who work seamlessly together to save lives every day and make our trauma center the best of the best. I would like to thank my acute care surgery and trauma partners who challenge me every day to remain patient-centered in all that we do. I cannot thank you enough. I also cannot thank enough, in particular, my right hand, Beth Broering, who's just simply incredible. And I just thank you, Beth, for all that you do for us. As well as my other right hands, Abdul Hamid Noor, Katie Kolab, and of course, my boss, Dr. Kasarajan. I particularly like to thank our office staff who are special and have to deal with trauma surgeons every day, which is not easy. I would also like to thank Dr. Mike Feldman, Medical Director of the Evan Haynes Burn Center, and Dr. Jeffrey Haynes, Medical Director of the Children's Trauma Center. Also like to thank Dr. Harinder Dehinsa, Chair of the Department of Emergency Medicine, Dr. Alice Coombs, Interim Chair of the Department of Anesthesia, Dr. Stephen Case, Chair of the Department of Orthopedics, Dr. Alex Valatka, Chair of the Department of Neurosurgery, Dr. Ann Fulcher, Chair of the Department of Radiology, and I could keep going on and on of all the amazing leaders at VCU Trauma Center who share the vision of our comprehensive trauma center. I do like to thank specifically the pillars of our prevention program, Cheryl Garland, Dr. Robin McDougall, and Dr. Robin Foster, as well as the entire team of the Injury and Violence Prevention Program. You guys are amazing. As well as our Trauma Center for Trauma Critical Care Education and our Trauma Supporters Network, who are all equally amazing. I must especially thank the Gala Steering Committee and Sponsorship Committee's members who've done just a phenomenal job, as you could see, and the tireless work of Amanda Van Tunen, who made all this happen. And of course, Joe Cotton-Cooler and his team, especially David Moorfield, who created our wonderful videos and is hosting our webinar, and really our just overall amazing staff. I would like to thank my beautiful, brilliant wife, Charlene, who my son Michael said, you can't just say thank you, you have to say why. It's gonna take a lifetime. So will really support me along the long way in every step, especially in this pandemic year. I also like to thank those who had to work tonight and could not really be with us, even virtually. Finally, I'd like to thank Dr. Rao, Dr. Kellerman, and Dr. Buckley for joining me live at the Gala and for all their incredible support for our comprehensive trauma center every day, every minute, along with the rest of the VCU leadership. Next year, we're looking forward to our 13th Shining Light Gala, which will hopefully take place in person. So mark your calendars for Saturday, May 21st, 2022, at the Greater Richmond Convention Center. And again, if tonight's program has so moved you, you can click on the link on your screen or go to vcuhealth.org/ShineLightGala to support our program. Thank you all, and I wish you a wonderful night, and the rest of your weekend may be safe and a great, great, great weekend. Thank you again.